While methadone is an essential medication used in the treatment of opioid addiction, it is not without significant risks. Despite its benefits in managing withdrawal symptoms and reducing cravings, methadone can be dangerous if misused or taken improperly. It is a potent opioid, and like all opioids, it carries the potential for physical dependence, overdose, and even death. Methadone affects the central nervous system and, when not used as prescribed, can lead to serious health complications, including respiratory depression, especially when combined with other depressants like alcohol or benzodiazepines. The risk of overdose is particularly high, as methadone has a long half-life, meaning it stays in the body for an extended period, which can lead to the accumulation of dangerous levels in the bloodstream. Additionally, individuals who are new to methadone treatment or those who have not been using opioids for a while may be more vulnerable to its harmful effects, as their tolerance to opioids may be lower. It is crucial that methadone is used only under the supervision of a healthcare professional, as improper use can have serious, life-threatening consequences. Always follow prescribed dosages and consult a medical professional if you have concerns. Misusing methadone not only jeopardizes your health, but also increases the risks of addiction, overdose, and other dangerous outcomes. The benefits of methadone treatment can be significant, but only when used responsibly and with the proper medical guidance. Methadone is a synthetic opioid medication used primarily in the treatment of opioid addiction. As part of medication-assisted treatment, MAT, it helps individuals manage withdrawal symptoms and reduce cravings, providing a safer alternative to illicit opioids like heroin. Methadone was first developed in the 1930s and gained widespread use in the 1960s for opioid addiction treatment. Unlike street opioids, methadone is prescribed under medical supervision, making it a regulated and controlled option for individuals in recovery. Methadone works by acting on the brain's opioid receptors. These receptors, when activated, provide relief from pain and regulate emotions. While methadone is an opioid, its effects differ from illicit opioids in that it has a slower onset and longer duration of action. This slow release prevents the intense high typically associated with heroin or oxycodone. Methadone provides a controlled and consistent dose that helps stabilize individuals, preventing the physical and psychological effects of withdrawal. Methadone treatment programs are typically managed in specialized clinics. These clinics offer structured dosing, ensuring patients receive the correct amount of methadone. Since methadone is a potent drug, its use is closely monitored to avoid misuse and ensure patient safety. It's important to note that methadone is not a cure for addiction, but a tool to help individuals in their recovery journey. Often used in combination with therapy and counseling, it provides the physical stabilization necessary for long-term recovery efforts, reducing the chance of relapse. Methadone works by interacting with the brain's opioid receptors, primarily the mu-opioid receptors, which are involved in pain relief and pleasure. When methadone enters the body, it binds to these receptors, mimicking the effects of other opioids like heroin, but in a much more controlled and gradual manner. This interaction alleviates withdrawal symptoms without producing the intense high of other opioids, which is why methadone is effective in treating opioid addiction. Methadone has a long half-life, meaning it stays in the body for an extended period, 24-36 hours. This prolonged presence in the bloodstream provides a steady level of the drug, reducing fluctuations that can lead to cravings and relapse. Unlike short-acting opioids, which require frequent dosing, methadone can be taken once daily, offering convenience and consistency for patients in treatment. The drug's long-lasting effect stabilizes individuals who may otherwise experience disruptive withdrawal symptoms. Methadone helps prevent the discomfort that comes with quitting opioids, including sweating, nausea, and muscle aches. Its sustained action reduces the risk of a patient seeking illicit opioids, thereby decreasing the likelihood of relapse. However, methadone's long-acting nature also has its risks. If taken in excess or combined with other central nervous system depressants, such as alcohol or benzodiazepines, methadone can slow breathing to dangerous levels, leading to respiratory failure. For this reason, methadone treatment must be carefully monitored by healthcare professionals to ensure patient safety and prevent misuse. Methadone is considered one of the most effective treatments for opioid addiction. One of its main benefits is its ability to alleviate withdrawal symptoms and reduce cravings, which are often the primary challenges individuals face when overcoming addiction. Withdrawal symptoms can be intense and difficult to manage, but methadone helps to smooth out these symptoms, making it easier for individuals to stay committed to their recovery. By stabilizing opioid levels in the bloodstream, methadone helps prevent the physical discomfort that would otherwise lead to relapse. In addition, it provides individuals with the time and energy to focus on other aspects of recovery, such as therapy, counseling, and rebuilding their lives. The reduction in cravings helps patients regain control over their emotions and behaviors, which is critical for successful long-term recovery. Methadone has also been shown to improve social and occupational functioning. As it stabilizes individuals, they are more likely to maintain employment and engage in meaningful relationships. This improvement in daily life activities leads to a greater sense of normalcy and empowerment, which are essential for sustaining recovery. In fact, studies show that people in methadone maintenance programs have lower rates of drug use and are more likely to remain in recovery over time. For pregnant women with opioid use disorder, methadone is often preferred over illicit opioid use, as it provides a controlled and safer alternative. Methadone treatment, when carefully managed, has been shown to reduce the risks of withdrawal complications for both the mother and the baby, leading to better outcomes during pregnancy. Methadone plays a significant role in harm reduction strategies, which aim to minimize the negative effects of drug use while supporting individuals in their recovery. Harm reduction focuses on providing practical, evidence-based interventions to reduce risks like overdose, the spread of infectious diseases, and criminal behavior. Methadone treatment is a key component of this approach, helping individuals avoid the dangers of illicit drug use. One of the primary goals of harm reduction is to meet individuals where they are in their recovery journey. Methadone provides a controlled, legal, and regulated alternative to illicit opioids. This approach helps stabilize individuals, offering them an opportunity to address addiction without the risk of encountering contaminated or unsafe street drugs. By reducing the need to seek illicit substances, methadone also reduces the social stigma and criminal activity often associated with drug use. Methadone treatment programs are frequently combined with other harm reduction services, such as needle exchange programs, overdose prevention, and education on safer drug practices. These comprehensive services help individuals who may not be ready to quit all drug use immediately, but still want to lower their risk of harm. Evidence shows that harm reduction strategies, including methadone, can lead to fewer overdose deaths, better health outcomes, and reduced transmission of diseases like HIV and hepatitis. Although methadone is an essential tool in treating opioid addiction, it is not without its drawbacks. One of the main disadvantages of methadone use is the risk of developing physical dependence and tolerance. Over time, individuals may require increasing doses to achieve the same effect. This tolerance can make it more challenging to wean off methadone and may contribute to a sense of dependence on the drug itself. As with other opioids, methadone can lead to withdrawal symptoms if a person tries to stop using it abruptly. These withdrawal symptoms can include sweating, muscle aches, irritability, and fatigue, similar to the withdrawal experienced from other opioids like heroin. While methadone withdrawal is often less severe than withdrawal from other opioids, it still presents a significant challenge for those who wish to discontinue its use. Furthermore, while methadone can alleviate cravings for heroin or prescription opioids, it does not address the psychological aspects of addiction. Individuals who use methadone for extended periods may still be dependent on the drug emotionally or psychologically. For many, overcoming addiction requires more than just physical stabilization. It requires addressing the root causes of the addiction through therapy and counseling. One of the most significant concerns with methadone use is the potential for overdose. Although methadone is considered a safer alternative to street opioids, it still carries risks, especially if taken inappropriately or combined with other central nervous system depressants like alcohol or benzodiazepines. Overdose symptoms from methadone can include slow, shallow breathing, loss of consciousness, and in extreme cases, respiratory failure. Because methadone has a long half-life, it stays in the body for a longer period than other opioids, increasing the risk of an accidental overdose if taken in excess or in combination with other drugs. Individuals who are new to methadone treatment or those who have recently stopped using opioids may be more vulnerable to overdose, as their tolerance to opioids might be lower. To mitigate the risk of overdose, methadone is carefully prescribed and monitored by healthcare professionals. Patients are typically required to attend regular appointments at a methadone clinic, where their progress and response to the medication can be closely monitored. This level of oversight is necessary to ensure that individuals receive the appropriate dose and avoid dangerous interactions with other substances. Methadone can have psychological effects, particularly in individuals who have been on the medication for extended periods. Some users report experiencing emotional numbness or a sense of detachment while on methadone. This emotional blunting can be problematic, as it may interfere with the person's ability to fully engage in therapy or recover from the psychological aspects of addiction. In addition, some individuals on methadone experience mood disturbances, such as depression or anxiety. These side effects can make it difficult for individuals to maintain stable emotional health while in recovery. While methadone can stabilize the body physically, it does not address the underlying mental health issues that may have contributed to addiction in the first place. For individuals with pre-existing mental health conditions, methadone may exacerbate symptoms or create new emotional challenges. Therefore, Methadone treatment is typically paired with other forms of psychological support, such as therapy or counseling, to ensure that individuals receive a comprehensive approach to recovery that addresses both their physical and emotional well-being. Methadone treatment can have social and legal implications for individuals in recovery. Although methadone is a prescribed medication, it may carry a stigma, especially for those who are working to reintegrate into society. Some people may view methadone as a substitute drug, which can lead to judgment and discrimination. This stigma can affect various aspects of life, including employment, housing, and social relationships. In addition, methadone use can present legal challenges, particularly for individuals who are subject to drug testing, such as in the military or certain workplaces. Although methadone is legally prescribed, its presence in drug tests can raise questions about an individual's past substance use, even if they are actively working toward recovery. This can complicate efforts to re-enter the workforce or engage in other aspects of society. Another potential issue with methadone treatment is the risk of misuse and diversion. Although methadone is intended to help people in recovery, it can be misused by individuals who are seeking a euphoric high. Some individuals may attempt to take larger doses or use methadone in combination with other substances in order to achieve a stronger effect. Additionally, there are instances where methadone is diverted from legitimate users to the illegal drug market. Methadone is often sold or distributed by those who are prescribed the drug, contributing to the broader issue of opioid misuse. This diversion of methadone can undermine its intended use and lead to increased misuse within communities. Because of the potential for misuse and diversion, methadone treatment is highly regulated. It is typically dispensed in clinics where patients are monitored closely to ensure that the medication is being used appropriately. Despite these precautions, the risk of diversion remains a concern for healthcare providers and law enforcement. Methadone is a valuable tool in the treatment of opioid addiction, offering significant benefits such as withdrawal relief, reduced cravings, and improved social functioning. However, it is not without its drawbacks, including the potential for dependence, overdose, and misuse. For methadone treatment to be successful, it must be part of a comprehensive recovery plan that includes medical supervision, therapy, and support services. Methadone is not a cure for addiction, but can be an essential part of the recovery journey. When used appropriately and monitored closely, it provides individuals with the stability needed to focus on the psychological and social aspects of their recovery. Ultimately, methadone, combined with other forms of treatment, offers individuals a pathway to a healthier, drug-free life. Methadone plays a critical role in the treatment of opioid addiction, offering individuals a controlled and effective means of managing withdrawal symptoms, reducing cravings, and improving overall recovery prospects. However, like any medication, it must be used responsibly and under strict medical supervision. The potential for misuse, overdose, and long-term dependency highlights the importance of careful monitoring and adherence to prescribed dosages. While methadone offers hope for many struggling with opioid addiction, it is not without its risks. The path to recovery is complex, and methadone should be just one part of a comprehensive treatment plan that includes therapy, counseling, and ongoing support. Addressing both the physical and psychological aspects of addiction is essential for long-term success. Ultimately, the goal of methadone treatment is to help individuals regain control over their lives, reduce the harms associated with opioid use, and provide a foundation for sustainable recovery. With the right precautions, education, and support, methadone can be a powerful tool in overcoming addiction. But it is crucial to approach its use with caution and respect for its potential dangers. Always seek guidance from healthcare professionals and prioritize your health and safety throughout the recovery process.